Hi everybody and welcome back to my vlog. So this week, at the special request of Sophie, the lovely Sophie, and thank you for doing it, I'm going to be covering diseases based around gluten, and that's gluten that we eat. And I say that because there are several different processes that go on, some more controversial than others, some with more evidence behind them with others, but I'll give you what there is. And in terms of a couple of them, there isn't a lot of actual evidence. So first of all, what is gluten? So gluten is a family of proteins that we find in certain foods, and those include glutenin and gliadin. And gliadin is the most common digestive irritant, the one that's causing all the problems. It's found in things like grains, wheat, rice, spelt, barley. And wheat is the most commonly consumed of all of those grains. Gluten can be problematic for some people, and it manifests itself as something called celiac disease, and that's recognised, easy to diagnose with clear tests and easy to treat. And by easy, please don't jump up and down to say it's not easy at all. What I mean is we know what's needed to treat it. That doesn't make it easy for the people having to do it. Gluten sensitivity, or non-celiac gluten sensitivity, as it's sometimes known, is sometimes called gluten intolerance, but there has actually been a very well accepted statement worldwide that says actually the correct term is gluten sensitivity, so that's what I'll call it in here. And that's for people who get symptoms when they eat anything containing gluten, but they don't have celiac disease. And then there's wheat allergy. And wheat allergy is specific to wheat, and probably the gluten in wheat, but specifically to wheat, and it is actually an allergy. There is an underlying immune allergic response going on. And it would also seem that gluten probably plays a role in irritable bowel syndrome, but I'll come on to that. So just to start with celiac disease, because that's the one that we know about and is the one that people know about most commonly. That affects about 0.7 to 1% of the population. So for every 100 people, there is under one person that suffers from celiac disease. So it's rare. It is an autoimmune disorder. The body actually attacks itself when you eat anything containing gluten, anything at all. And that damage, that attack in ourselves then damages the gut wall, and it causes the intestine to become more permeable, so things leak through it much easier, and that allows poisons or toxins, bacteria and undigested food proteins to move through the gut wall that wouldn't necessarily normally be able to go through it, and that then causes problems in the body. And those problems that we see with celiac disease are vast. And they include pain, so abdominal pain, bloating, diarrhea, constipation, headaches, tiredness, skin rashes, depression, weight loss, horrible smelling poos, so foul smelling feces, anemia, and a chronic disease, fatigue, that just saps all energy from the body. I think I mentioned tiredness, but it is a chronic fatigue. So that's celiac disease. Then there's wheat allergy, which again only tends to affect about 1% of the population. It tends to occur in children between the ages of 3 and 5, and in the main, after that, it resolves. So most adults are not allergic to wheat, even if they were as a child. And that often happens with allergies. I mean, I had severe allergies as a child to eggs, tomatoes, penicillin. I certainly don't have those allergies now. Don't know about penicillin because I haven't checked it, but I should. But certainly I eat tomatoes and eggs without any problem now. And I had anaphylaxis as a toddler. So most children grow out of allergies, and wheat is included in that. It is an immune system response to wheat, which is the allergen, but it's not an autoimmune disease. The reaction to wheat, if you eat it when you've got a wheat allergy, generally happens within minutes, so it's instant. and you get itching, hives, eczema, nausea, diarrhea, vomiting, wheezing, asthma-like symptoms, allergic rhinitis, sneezing, so runny nose, blocked up nose, a bit like hay fever, bloating, and in the worst case scenarios, anaphylaxis. So that is a severe life-threatening allergic reaction. So that's wheat allergy, and it is mediated by gluten, but it's not the same as celiac or gluten sensitivity. So gluten sensitivity is where we're going to mainly focus because that's what I was asked for. So the symptoms of gluten sensitivity are similar to celiac. So even for people that definitely don't have celiac disease, they get similar symptoms to celiac without the same reaction. It affects anywhere between 0.5 and 13% of the population. So it's a much bigger number of people that seem to be affected by gluten sensitivity. As I said, there's no immune system involvement, there's no antibodies produced, no damage happens to the gut. The lining of the gut is normal if you look at it under a microscope. There's no increase in that intestinal permeability to toxins and bacteria that we spoke about with celiac. So there's nothing manifesting itself in the gut, but notwithstanding that, there still seems to be a prevalence of symptoms, many of them nothing to do with the gut. So many of them extra-intestinal or non-GI. And they usually appear within hours to days, so longer than the wheat allergy. And they include headache, foggy mind or inability to concentrate or focus, joint pain, numbness in the arms, legs, fingers, bloated tummy, lots of gas, belching, abdominal pain, diarrhea and constipation, nausea and fatigue. So as you can see, very similar symptoms to celiac disease. So how do we diagnose these three different conditions? Well, the wheat allergy can be diagnosed by symptoms alone, so we can see what's happening when you eat wheat. But then we can actually do blood tests where we look for IgE antibodies to albumin, globulin, gliadin, glutenin or gluten. And if you have a positive blood test, IgE test to any of those, then you get a confirmed wheat allergy diagnosis. Celiac disease tends to be a blood test, TTG IgA blood test, but also a bowel biopsy. So we take a small portion of the bowel wall and look at it under a microscope, and that can be absolutely definitive in terms of diagnostic criteria, because the bowel wall looks very different in people with celiac disease. So a blood test and or a bowel biopsy, small bowel biopsy. You must have gluten in your diet leading up to either one of those tests so that we can actually see the reaction going on, because the cure for celiac disease is to not eat gluten, and then those changes in the gut will disappear. So you have to have it leading up to the test so that it can be confirmed. Now, gluten sensitivity diagnosis, and I think this is the one that most people are focused on because it's a bigger group of people who suffer. And it's not simple, I'm afraid. So there's still much about this that we just don't know, and we really don't. There are no biological markers at the moment, so none of those blood tests that we can do for celiac. I'm sorry, my phone's going off and I thought I turned it off. But I'm not going to stop, I'm going to just apologise. Currently no recommended tests at all for gluten sensitivity in terms of diagnosing it. There are some doctors who will offer blood tests, saliva tests, stool tests, but none of these tests are validated. None of them have evidence behind them to say that yes, these work and they're uniform and they'll always give you a diagnosis. So at the moment, I would say they're not really worth very much, because if you've got a no, because they're not validated, it doesn't mean that you don't have it. There is currently lots of research going on into biomarkers for gluten sensitivity, and with time, hopefully, we will get a test that will tell you if this is actually what you're suffering from. So the only way we can diagnose gluten sensitivity is as a diagnosis of exclusion. And what that means is we test first for other things that it might be, like celiac and wheat allergy. And if both of these are negative, but you still have all of these symptoms, then a trial of a gluten-free diet is certainly worthwhile. And if the symptoms get better, then that's really the diagnosis. And it's a lot like that for lots of allergies anyway. So in GP, when we see people with allergies and they want tests for them, we often say, well, no, just take that out of your diet or stop using that shampoo. And if it stops, then you know that you're allergic to it and you mustn't use it. It's the same kind of thing. So I guess the question is, if that's the case, why not just go gluten-free? Why do you need to know if you have gluten sensitivity? Well, the answer is that if you have celiac disease, you should know. Because firstly, it needs lifelong treatment. It's not something that's going to recover or change. Family members may need testing if you've got celiac because it runs in families. And you just need to know what's going on so that in the future, if there are any medical issues in terms of malabsorption, tests that you need, that you know that that's your underlying diagnosis. And I think that is important. So I think testing is important and having the answer is important. Okay, so what food contains wheat and gluten? The list is absolutely endless, so I won't bore you senseless, I'll just give you a flavour. But you're looking at all of the breads, pastas, pastries, cakes, biscuits, beer, some wines because of the additives, soy sauce, hydrolyzed vegetable proteins, couscous, cereals. You're even looking at some shampoos and soaps, which you might not think you're ingesting, but you might be, and also which might be being absorbed through your skin. So in order to not bore you senseless and to give you something that you can look at, I'm going to put a list afterwards, a website that gives you a really nice list of all products and foods that contain wheat and gluten. And that's drpearlmutter.com's website, and it's very good and it's easy to navigate. So that will be in the description for you. So I mentioned earlier that the diagnosis of gluten sensitivity is controversial. There are many doctors that do not believe that this exists as an issue. Interestingly, studies consistently show that about 25 to 30% of people believe themselves to be gluten sensitive and so keep themselves on a gluten-free diet. But in studies, only 11 to 14% of the population actually are. So there's a big proportion of people that feel that they are sensitive but are not proven so in tests, which I find interesting as there is not actually a test to prove it. However, it could be that they're just not being identified properly. It could be that they have something else going on. And there is a very interesting link with irritable bowel syndrome. I have done another vlog on that, so you can pop over there if you want more information on that. So very similar symptoms to gluten sensitivity are seen in irritable bowel syndrome. So we're talking about bloating, burping, gas, diarrhea, constipation, abdominal pain. So really similar. And we manage IBS, which is another diagnosis of exclusion, with diet and stress reduction, because we know that stress can play a part in that. Some people who have IBS, however, benefit from a gluten-free diet. So that's really interesting. And there are other conditions that benefit from a gluten-free diet as well. We know that people with schizophrenia, autism and gluten ataxia benefit from a gluten-free diet. So gluten certainly seems to be a bit of a baddie here. Whether or not it is, we just don't know, but there is lots of research underway. So in terms of IBS and the link there is a diet that people with IBS use called FODMAP, and it stands for this most unpronounceable thing, which is fermentable oligo di monosaccharides and polyols. We'll just call it FODMAP for now. So basically these are really poorly digested carbohydrates that don't get digested through the bowel, and they end up at the end of your bowel where bacteria use them as a breeding ground for fuel, and so you then get an overgrowth of bacteria. There's certainly a link with IBS and these, and we know that gluten containing grains are high in FODMAPs. So it might not be gluten at all. It might be these poorly digested carbohydrates. But there is research underway on that, and there's certainly a link, and it's certainly interesting. So I'm going to put another website for you in the description called beyondceliac.org, which looks at the research which is underway and talks to you about other research that's ongoing. And there's a very nice question and answer section on there with two professors who are working quite hard in this area. So I would have a look at that website because it will answer many more of the questions which I haven't had time to do here. But in summary, what I would say is if you think you have celiac disease or gluten sensitivity, please see your GP. Because even though I've said that many doctors don't believe it exists, and I've said that cutting out gluten from your diet solves the problem, it is really, really important to get tested and get a diagnosis. So that's number one. It's really important that you're eating gluten for at least a few weeks before you have any tests. Even I know it's going to make you unwell, but if you want a definitive diagnosis, that's crucial. Have a look at the FODMAP diet. The link to it is actually in the IBS vlog. And have a look at the sites that I'm going to list below, which will give you more information on gluten sensitivity and the foods and things to avoid if you think you have it. Certainly a lot of people feel a lot better on a gluten-free diet, and there's no harm as long as you're getting a balanced diet. You don't need carbohydrates in the form of pasta, bread, gluten, because you get lots of carbohydrates from other things. If it makes you feel better, then that's great, and I'm all for it. So I hope that's been interesting. It's kind of been a whistle-stop tour, but there's not an amazing amount of information out there. But any questions that you've got, please just post them afterwards and I'll try and answer them for you. If, like Sophie, you have a topic that you'd like me to cover, please let me know. Just pop it into the comments on any one of the vlogs. I see them all and I will cover it for you with pleasure. So as always, thank you for watching. I hope it's been helpful and I'll see you soon.